Good morning, my dear ones. Of course, it might not be morning when you're watching this, but this is Monday morning, and it is Jake's birthday in Australia. Jake! How old are you, Jake? I tell you what, when you get my age, you don't want to hear birthday what? Na 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 na. You don't want to hear birthdays. I guess when you're younger, it's like if you can get up into the 30s as soon as you can. That always seems to be a good 30s to 40s, a good rock time. I don't know. Crap, I passed that a while back. Oh, my God. So happy birthday, Jake. We had Mother's Days, birthdays, Cinco de Mayo. I mean, we've had all kinds of parties going on. That Cinco de Mayo, oh my God. All I had was a taco salad with extra lettuce and tomatoes. And I just wanted something on there besides lettuce and tomatoes, so I put the salsa. The next day, man, pooperino. Oh my God. I don't eat that kind of stuff. Holy moly. Amber. Hi, Amber. 41. Is it your birthday? So this is Amber. She's age 41. A question about checkups with doctors. Yeah. God. That reminds me of that... I can't remember the name of the movie, but it was about this famous choreographer. And what was the name of that movie? And he smoked like a fish. He was always coughing. And Roy Schreider or whatever played that role. And coughing and coughing, but he had to pass his physical. And he was a smoke fiend, and just lungs, you could tell he was going. So they found a medical doctor, way overweight, smoking like a fish. They brought him in the office, and they were all smoking. Oh, my God. Yeah, cough and turn around, you're good. You know, that's why I say when you go in for a physical, of course, if you have a good doc, he's going to run a blood work on you. See what your blood's looking like. Of course, it's going to check your blood pressure on one side only. Listen to your lungs. I don't know too many that stick an EKG on you, especially a GP. If I was a medical doctor, I would stick an EKG on you, EEG. I'd run you through it. But you got the iris. What an incredible view. I wanted to one time not be a naturopath that way and just do iridology pictures and sell them to the medical doctors as a test and have a complete printout of all the problems. They wouldn't know what to do with it, though. So I decided not to do that. Dr. Morse, I hope you're doing well. Yeah, so far. I have a question about, I'd like your opinion and advice on going to doctors for checkups. Well, you know, there's do you need it? Okay? And that's okay if you have, you know, it seems like you have to have, in today's medical world, you have to have a primary. Then you can have your specialists all over the place, but you got to have the primary. And it's like, oh my God. All I can say is, some things they have are pretty cool, like CAT scans for kidney stones. You know, some things it's important. The medical world is a very important world. If it would learn how to use toxic-free pharmaceuticals, and it would learn that there's no such thing as diseases, that we're facing real chemistry problems, and that means they would have to learn the lymphatic system as we teach it. Not as your A&P class teaches it, but as we teach it. And it's easy to learn and understand then. It really puts a lot of the check boxes it checks all the boxes, and you begin to understand why there's inflammation, the inflammatory response, and what that is, and how cells are damaged in the body, and all that other stuff. It really explains everything to you. Do you think it's necessary to get a checkup or blood work done? I have definitely sent my patients to have blood work done. I've done that, right? We're talking about really sick people. And I look at the liver enzymes, the alkaline phosphatases. I look at the creatine bun. I look at things like that. It's not something I get, it's just a look in the blood. The real problem's in the lymphatic system. That's where the problems always are that lead to blood problems. So you can look at the blood and see where you have problems, but you always have to pull yourself back and understand it's the lymphatic system that causes the problems. I mean, if blood caused the problems, man, nothing could live. And if you have to have a checkup for something, I don't know what, some companies require stuff, I don't know. I feel like it's also invasive and have avoided going to get a checkup for the past year and a half because I don't want to be poked or prodded. Well, poked and prodded might be something else, push here, push there. The sad thing is that they didn't accept iridology. It was a medical doctor, and in its final analysis, it was a surgeon that discovered iridology. I mean, it's so ironic, but you hear that all the time. It was a lonely naturopath that discovered the fact that the kidneys are the main eliminative organs of the lymphatic system, and that the kidneys have to filter. Also, I'd like to know your opinion about pap smears for us females. Well, that's why I invented the Heal-All tea, because I kept getting from pap smears atypical cells. And then I have her painting in the lobby here, but she was the granddaughter of the gentleman who invented pap smears, Dr. Papalopoulos, Greek. And she came to me with cervical cancer. But as long as you understand that your body can be full of atypical cells, and that there's a journey cells go on between being their genetic selves and then to the degraded level of what medical doctors might call the cancer cell. And there's only one side of chemistry that does that. I guess you could claim if you were running 12 pH through the body all the time, you could damage a lot of cells, but that's not what's happening. Acids are what's damaging the body, the cells. When we say body, we're talking about cells. I mean, keep it simple. When you look at the heart, here's a good example. The heart, 4 chambers, gate or a valve between each two, right? All right, so that's the heart. Well, wait a minute. Let's take it the next step deeper. What's the valves and the chambers made of? And then you get to the reality of what I've been teaching is that the body's basically a bunch of cells and 2 fluids that take care of them. That's as simple as you get. But that's an important foundation, in my opinion, to have, because you have to understand what's damaging cells, what's creating a atypical cell, whether it's vaginally or anywhere else. So I'm not opposed to pap smears, I guess. Scrape here, scrape there. Oh, God. I would say this. Working with teas, I love teas, especially for douching and enemas and stuff like that. And also orally, it's like our acid reflux tea. You can douche with that real easy. But the Heal-All tea is a tea that, just converts these cells back to healthy cells, because it's a lymphatic kind of tea which is helping to relieve the burn from the cells, from the acids interstitially. So I've always been able to reverse atypical cells with just a woman douching with the Heal-All tea. But if you need to know and need to look, if you have a lot of vaginal discharge, that's a problem. If you're bitter down there, your juices are a little bitter, you have too much estrogen. And estrogen added to lymphatic stagnation can definitely burn you. And that's because atypical cells are burnt cells. And this is all coming from the acid side of chemistry. However, estrogen is in the upper 5s pH, and it's been claimed that at 5.5 you lose your enamel of your teeth. I would think in looking at the divine, the creator, you wouldn't naturally produce a steroid of an acid that's enough to rip calcium out of you. Wouldn't make sense. But there is this variation. Remember logarithm, so it's 10 times 10. So there is this variation. Like if your estrogen was 5.5 and you started breaking down cells at 5, there's 5 times difference in acids. Well, let's get down to chemotherapy. We're at 500,000 to 1,000,000 times acidically hotter. Just looking at it as your blood. Your blood's not acidic, but looking at pHs, you're looking at going down to the acid rabbit hole, you're talking extreme pHs, like hydrochloric acid. It's an extreme drop. But when you're eating dead animals, that's very condensed amino acids. And so, it's all through the chain of peptides and polypeptides. But that's why you need the wrecking ball of hydrochloric acid and pepsin to break down these heavy stacked polypeptide chains. Because in reality, the amino acid is the only thing the body can really use. So it's just that sort of thing. When you're eating fruits and vegetables, these are lightly stacked amino acids. So the need for hydrochloric acid is minimum at that. Because then you look at right after that, within a few inches, you need trypsin and chymotrypsin to deal with the polypeptides and peptides. We're getting to the amino acid stages. Well, you've got to be almost 7 or above pH to release those. Oh, wait a minute. I'm moving from a 1.8. Like some chemists think hydrochloric acid is 0 pH. I was taught 1.8. I mean, if you Google it, you've got 1.5, you got 0, you've got all kinds of differences. But even let's just give it a 1.5. Look at the difference between 7 pH and 1.5. You're talking about 5,750,000 degrees difference. I mean, it's major when you look at that. So that's why when you feel, I don't know what uric acid is, but even uric acid somewhere around 3 to 4, somewhere there, and that's that uric acid. Ow. So if you feel like if you've had discharges and stuff like that, and you feel like you're estrogen dominant, having a pap smear doesn't hurt, but what do you do about it? See? And I feel that if you get your iris picture, look at the vaginal wall there, lymphatically speaking, look at the cervix, and then you have the uterus on top. Take a look at all that, and remember the bowel connection to that. So when you understand that the GI tract has a connection, everything, because that's that embryonic trunk. You remember when the sperm meets the egg, you got an egg, right? But that egg has to move into a fetus, an embryo, and move through that embryonic stages. Well, that's that embryonic tail, I call it the tadpole tail, is your gut, GI tract. Like I said, N.W. Walker had a chart, and Dr. Jensen had a chart. They were different in relationship to where all your organs and glands came off and the electrical relationship all along that wall. If you have a lot of acidosis in an area of your bowel, for example, mid-descending bowel is where your heart came off, you could have chest pains when the problem is in the colon. So, I mean, it's just like that relationship. We talk about the relationship to the pituitary, pineal, and the head area, sinuses and all this draining. This is going right down to the transverse portion of the colon. And then, of course, it's connected to your throat. Your throat gets backed up with mucus, so does your sinuses. You can clear that throat, and you can feel your sinuses drain. You can feel the connection all this has lymphatically. But only if you need them, if you feel like you need them. The thing is, basic, I don't even know what to say about it. For a male, it's like, don't finger me, man. I can see in my eye where I'm going. And then you can pull a blood work, like for a male, and look at the PSAs and stuff like that. I just recently had a PSA. Mine was 1.1, which 3 used to be normal. 0 to 3, you were within normal ranges, and 0 to 4. Then they moved it up to 0 to 4, and I'm going, why do you guys keep increasing the top number? Because your stats keep coming higher? Because I've had prostate cancer in my office at PSAs of 2. But then I used to speak at the American Cancer Society. Their prostate groups are called Man to Man. And I had a guy was giving a lecture there one time, and his PSAs are 20, and they had poked him many times and couldn't find any cancer cells. And I'm going, 20? And couldn't find any? Oh, wow. So I say if needed, if you feel that. But if you feel like you're in trouble, you know how to take care of yourself. You're going after what system always? Always. If you have heart problems, what system are you going after? If you have lung problems, what system are you going after? You're going to take care of the blood. You've got to go after both systems. So how do you take care of the kitchen system, the blood system? Diet. Change your diet. Right? It's that simple. Go to a fruit diet. You're a frugivore. As a Homo sapien, go to a fruit diet. Blood's going, thank you. All the blood clots start breaking apart. The red blood cells attaching or following each other like choo-choo trains, breaks apart. Enzymatic-rich foods, but especially fruits, high in flavonoids. Oh, yeah. So, go into the fruit side of that. All right? All right, the kitchen, check. Now, how do you go after the sewer system, the lymphatic system? Oh, diet, check. You need astringents, you need hydration, and that's what all an alkaline-forming diet is. That's why we talked about this Eretz mucilus diet healing system. All ingestion for most all vertebrates needs to be on the alkaline side, or the electron dominant side, or the electrolyte dominant side, however you wish to look at that. And that's going to be your fruits, your berries, your melons, and your vegetables. Period. Everything else is slipped over on the acidic side, unless you're talking raw mother's milk. But if you're drinking milk after the age of 1, you're going to have a problem, but especially after 2, anybody's going to have a problem with congestion and lymphatic stagnation and possibility of forming tumors. I haven't had a pap smear since 2023. Well, that's not bad. And I just can't make myself go back to get a checkup. Follow your intuition. I have to tell you that I listen. And I've talked about this with you guys before. A lot of people don't listen. They're too busy engaging in either talking or thinking. I listen. I'm watching and listening. So you guys come in to see me, I'm looking at you, I'm listening to you. I'm listening to all of you because each one of you are a deep being. I listen to the ethers. I listen to spirit, the prana, the life force. It's kind of like that kung fu where you had the old master, and then you had Cain, the little kid, and the master said something about a grasshopper at the foot. I think that's how he got his nickname, at the foot of young Cain. And young Cain, and his master was blind, and Cain looked up at him and said, how did you know? How did you hear the grasshopper? How did you know there's a grasshopper down at my feet? And the master turned to him and said, how is it you didn't see it? And that is because we're too busy planning and desiring and everything else, we're not sitting back and being in the now and listening. So be a good listener. It always helps. Especially when you got your clients or patients in, listen, they'll tell you their whole story and you'll know their whole problem right off. And if you feel like, and listen to your inner guidance, if you're not being pushed there, don't go there. Because no one likes the smell of an MD's office. And quite frankly, they're real limited in what they can help you with. But they're still essential to the plan, But my opinion on the negative side, especially those that are dealing with diseases. If you're a good surgeon and all, I've seen some good surgery here lately. It's just shockingly incredible, and it's like really cool. Link that with what we do with tissue regeneration, and you've got incredible healing, no scars. Of course, for burns, these people are monsters. They don't understand how you deal with burns. They don't understand your skin will rebuild itself. So when you're treated for burns, whether it's first, second, or third degree burns from the allopath, you come out scarred pretty bad. And there's no reason for that. My last pap smear showed damaged cells, and I refused all treatment and followed the protocol that I got from Jessica. Yeah. And then you douche, you douche with the Heal All tea, but knowing that that's almost like a topical application of herbs to the wall. The problems are in the wall. So what's in the wall of the vaginal wall? A bunch of cells and two fluids. How about what's in the wall of the cervix? A bunch of cells and two fluids. Remember, cells are structure, the structure of it, and the function, whatever that might be. And how many cells do we have? 75 to 100 trillion cells, and each are their own individual. Each cell's an individual. They might buddy up and as a team work together in some areas. But and these cells require the same two things everything does: consumption and proper elimination. And we find improper elimination is the problem, because the types of food that humans are eating are damaging the eliminative organs. Look at these studies after studies after studies linking protein diets to colon cancers. What they're not looking at is that same protein damages the kidneys, the urinary tract. Well, that one's the eliminative organs of your digestive tract, your undigested foods and stuff, your residues, and the other is the elimination of metabolitic kinetic waste from the cells. This makes sense. So you always want to go after your lymph system systemically. That is through the kidneys, get your kidneys filtering and all that, no matter where you find atypical cells or where they find cancer cells, so what? Then at the same time, in these skin cancer cells, I've never seen anything so much easier to deal with, and how many people have died from skin cancer, and it's like, you killed them. Unreal. So, and then, of course, it'll bring your estrogen into balance as well if that's an exacerbator, but the real reality is your lymphatic system. That's where endometriosis comes from. Same thing. It's all lymphatic. And it's all, around 3 pH, 4 pHs that are accumulating in the wall. And then they want to give you something that's 10 times to 20 times hotter to try to treat. And that's already at the level that'll destroy a cell, but they want to give you a chemical that's 10 to 20 times hotter than the acid that can destroy cells. So you're talking about super destroyer. It's insane. I haven't followed it faithfully since she gave it to me, but I'm currently on a fruit fast as I type this. Good. Yeah. Do the best you can. Get your teas. Definitely douche with the teas. Get used to douching with that way. There's so many things that clean up when you do that. I've had ladies get out some bizarre things by douching with the Heal All tea. I mean, some nasty looking stuff out of them. So it's pretty cool to be able to clean the body and feel clean from that. After following just protocol for a month, my period went back to normal. No more cramping or pains outside of the cycle itself. Remember, you must be a pituitary person. And keep working on your endocrinology. You know, those are the bosses, but there's still a bunch of cells and two floods. And even my cycle is painless for the most part and normal. Well, you want that. You don't want to have painful menses, and you don't want heavy menses. If you're having heavy menses, you're toxic. So you got to fix the endocrinology link to that, which is going to be ovarian, but also pituitary, right? Adrenals for additional steroids. How many places does the body produce estrogen? 3 or 4? That's all good, sweetie. So I'm perfectly confident that I've reversed the damaged cells, or at least have them clearing out, and I'm feeling good about that. Yeah, keep going. Keep looking at your iris, and keep going. Keep pushing your body. If you have stages of weakness, you have stages of weakness. Who cares? I mean, I don't judge anybody for anything. Thank you for answering my question. Oh, you're welcome, sweetheart. Thank you so much, Amber. But take care of yourself, because I've had ladies in with tumors up on the vaginal wall, and there's nothing fun about any of that. Yeah, there's nothing fun about anything like that. So, it's always a heads up. When you feel like you're in trouble, move yourself and get yourself strict. Get yourself on a fruit diet. Make sure your kidneys are filtering. Go after your kidneys, your lymphatic system, your endocrinology, and your GI tract. Fab 4 always. Then you can add to that. You do the female reproductive, which strengthens the ovarian and uterine tissue. And you can go after that. It's not an estrogenic formula. I don't make an estrogenic formula for females. Too many women are estrogen dominant. All right. Oh, Canada. Joanne, 64 years young. She's only 101 pounds, and she's 5'2". Eyes blue. Well, I don't know about that, but it's enough to say, sweetie, you are you're pituitary. Bang! I mean, at 5'2", there's no question there's a pituitary problem in this case, right? Oh, I better get a drink. I've had 14 lymph nodes removed in 2014 due to mastectomy of the left breast. Well, the only thing you can do is fix the problem now. In other words, it's funny, there's nothing to treat. You have to go fix the problem that you had. And so you've had lymph nodes removed. So what systems does the lymph nodes belong to? The blood? No, the lymphatic system. These are all types of lymphomas, right? In other words, it's all your lymphatic system. It's all the acid cytochemistry that's causing the problem and the burn of the cells. These guys don't realize this lymphatic system. So when your lymph nodes are swollen egg, we got to take that thing out. But remember this one research team. We can always remove a healthy lymph node out of another area and stick it in the area where you're getting lymphedema. What? Call me dum-dum, but it's like, what? So all I can say is you want to go back and make sure your kidneys are filtering. Work on that lymphatic system. Stay 100% raw, and the probability of you regrowing those lymph nodes are strong. You can regrow tonsils. So all I can say is, because we don't have any evidence that the body can regrow lymph nodes, we've never had cases to demonstrate that. Nobody's concerned or watching like that. But I would, 100% raw is where your body starts rebuilding everything. And I mean, we've given you some cases that's jaw-dropping of what the body can do. I mean, it's just like unreal, like realigning itself, pulling old fractures straight. I mean, it just keeps going on and on and on. And it's like, but you have to be 100% raw to do it. And I'd be going after my lymphatic system big time because your whole left side's involved, not just the breast. What's beneath the breast? What's under there? Lungs. And that's another thing you got to be concerned with, is that they didn't remove the lymph nodes that relate to the lungs, because that's the day I grew up in. I've had hundreds of female patients that have had mastectomies and lymph nodes removed and then come here with and then do radiation on top of it and then come to me with lung cancer. I mean, I just can't even tell you. Sad stories. I could tell you, but I'll start crying. I don't want to start crying. Just sad stories. Didn't need to be that way. Young women with children. I mean, you see why I have a real bad for the medical community in certain levels? And oncologists are criminals. They need to go to jail. That's not how, if we can't fix you, they sure as the hell can't. You can remove a breast, but you didn't fix the system that caused the problem. And this axillary area still has lungs, heart's still there. Your lymph system is still everywhere. You're backed up. Sewage is backed up. Septic tanks are swollen. Open up the cork, the kidneys, open up the kidneys, and everybody will drain, especially when you're hydrating. And the longer you don't, the harder everything gets. Remember, acidosis creates a cationic environment. Things are broken down and getting hard as a rock. Look at modeling. Ooh. Hard as all get out. And you need to fix your endocrinologies. 5'2". Diagnosed again in 24 with the big C, had metastasized in small bones and lymphatic system. See, all right, I want to go over this with you. Started a raw alkaline diet, but now want to go all fruit diet. Yes, ma'am. And I'm going to walk with you. Come on. Come on, sweetie. Let's all walk together, because that's where you need to be el pronto. But it didn't move on you. This is their verbiage. This is how stupid these people are. When your lymph nodes are swollen in the breast, your lymph system's backed up on this whole side. Just how much more is backed up in the head area? You're backed up all over the place. Your lymph system is everywhere. And you're backed up in your finger. You're backed up in your left arm, your left finger. That's why you always see lymphedema when they remove a lot of these breasts. You used to see a lot of arm lymphedema. Now they're trying to only remove the lymph nodes related to the breast. Really? And you have lungs there. And it didn't move to your bones. It's backed up. Look at the lymphatic system, and it didn't move into the lymphatic system. Your lymphatic system is the sewer system to every cell in your body. You have to have a sewer system in your house. Your house. The cell's a house. You have to have a lymphatic, you have to have a sewer system, as you have to have a kitchen, right? If you didn't have to consume, if your body was totally electromagnetic and you didn't have to consume energy that way, then you wouldn't have to eliminate energy that way. This is just a sewer system backed up. You didn't move on you. You're backing up, backing up, backing up, backing up. You're just becoming keenly more aware of it. Because as the sewage backs up, it's acidic, it's going to damage cells. That's why tumors are formed. Oh, let's put this in a cyst or a form. Let's protect the rest of the cells this way. You already were in trouble when you had a breast cancer. You were already backed up on this whole side. When your kidneys are filtering, they just don't filter the leg. So it's real important that you jump on a fruit diet and live all raw for a year or two. and make sure that these lymph nodes rebuild themselves and stuff like this, because just because your breast is gone doesn't mean all the other tissues around it is gone. Every cell, your chest wall, your bones, in one way or another, cells consume and eliminate. The medical world thinks the blood handles both sides of chemistry. Is there anything more stupider? That's water and oil mix. Anything more stupider? No. And the whole concept of cancer, is there anything more stupider? These guys are king-size stupid. I don't care how long they went to school or what school they went to. They're king-size stupid. You got a cell being damaged. The obvious question is, what's damaging? A cell didn't just go, oh man, I'm bad now. I'm going to turn bad. I'm a cancer cell. Sorry, that just doesn't happen. It's like C word just comes in from Moose Jaw, Alaska. What is the C word? It's an entity. It's an evil entity. Does it have horns on it? No. This is all about chemistry in your sewer system. They don't understand the lymphatic system. And so it's forgotten. Oh, your cancer cells now in your lymphatic cell always was, dumb butt. Alkaline blood can't create a cancer cell. Hello. Jesus. They're destroying a lot of people with this idiotic stupidity, and it's all criminal to me. I mean, you could say, oh, I'm protected under the medical community. Really? If I killed people like that, I wouldn't be protected at all. I'd probably be swinging from some gallows somewhere. Unreal. So rethink how you're looking at this, honey, because you're not moving. This isn't moving and crawling through you. Oh, I don't like that sound. I'm going to go get that one. Stupid. But your whole lymphatic system is backed up. Make sure your kidneys are filtering, and that's another little problem. We don't know when you see filtration whether you're seeing one kidney or both kidneys. You just keep going, keep going, keep going. But you're already at the point where you need to be 100% raw and stay there. Grapes, 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 grapes. Stay away from acid fruit. How can the lymphatic system work without 14 or more lymph nodes? It's a good question. Excellent question. So, I mean, the thing that I have to sit here and then tell you the truth, it doesn't. That's what the word lymphedema means. And if they remove the lymph nodes to the lungs, how does the lungs get its waste from, what's the lungs made of? Oh, a bunch of cells and two fluids. How does the cell waste from the lung tissue, the lung cells, how does it get out and go get out of the body if they remove the system that, or part of the system that allows it to do that? That's why I take this extremely seriously. And when humans wake up to the seriousness of what these oncologists are doing to people, these guys are in trouble. Because you can't adopt a philosophy that kills most of the people that take it on and claim that those few that survive are the miracles of life. No, your theory is idiotic and wrong. You're playing with the same side of chemistry that's causing all these problems. And it's just like, this is a serious, serious issue here. So once they remove lymph nodes, and 14 is a lot of lymph nodes. Oh, I've heard them remove 50 before. The 14 lymph nodes is a lot. What? That's a septic tank. What houses, what cells all fed into those lymph nodes that now don't exist? Those cells can't eliminate their waste anymore. And you'll find out because you'll start getting swelling. Swelling of the chest wall, swelling of the lungs, swelling of whatever. That's why it's serious, serious stuff. You've got to go fix the problem that your body's having, and your body's having a lymphatic problem. Of course. It didn't move to the lymph system. The lymph system is the system that's causing the problem. Where to move out of the blood? Yeah, give me a break. You know, cells are structure function, they're fixed. These tissues are fixed in the form of organs, glands, bones, muscle. But there are two fluid-based systems. One blood and one lymph that feed all of them in one way or another. And you've got to fix the one. Your blood's moving, or tissue would necroticize, you'd have gangrene, and pretty soon everything would turn black and dead. So you're getting blood to places, but your lymphatic system ain't honking well. And remember, the lymphatic system is your cholesterol, a lipid-based system. It doesn't move like a water-based system. And then you've got the adrenals, which in my opinion, and the parathyroid, which are both in its own way dealing in peristalsis, one neurologically and one calcium. So that's why you fix your endocrine glands, and you're only 5'2", you're pituitary. So in terms of coming to us for a physical is a lot more involved than going to a medical doctor. You're going to come out with a lot more awareness of what your body is really all about here, where a medical doctor, give me a cough, let me check your blood pressure, everything's in normal limits, you look good to me. But what about this tumor over here? Do they regenerate? That's a great question, and I like I said, I would love somebody to let me know that. But they have, tonsils have, I've seen other tissue have. We've regrown thyroids. We've seen everything regrow. The thumb, we show how tissue regrows itself. But get 100% raw is how we do it. I've said this before. You eat cooked food, there's no regeneration. 100% raw, and I use the herbs to go after, you don't go after that lymph system. How does the waste get by, or does it? It doesn't. That's like taking a sewer line. Well, imagine your house. I don't know how many of you are in houses with septic tanks. If you're in a city, you probably don't know what a septic tank even is. But houses, we're all around the world of septic tanks. Now, some, and when you live in a community, they have a sewer line that leads you into a big septic system. Or they take it to the treatment plant, which is a big septic system. Still has to have a way to get out. But in a normal house, you have a septic tank. And when you flush the toilet, all that goes into your septic system, including from your kitchen, right? That's why a lot of houses sometimes take the laundry water and move it away from the septic tanks because of the laundry detergents and stuff killing the bacteria. You don't want to kill bacteria, especially in your septic tank. So when your septic tank, your solids, your poo-poo builds up and bacteria start to work on it and break it down, fungus and stuff like that. Your liquid, your urine goes out into what they call a drain field and goes down through the aquifers and, down into the aquifers and water and recirculated again. It's filtered through the dirt and sand and all that other stuff. You remove that, be a problem, wouldn't it? So cells can no longer remove their waste. And that'd be like removing your septic system and keep using and flushing your toilet. Pretty soon, whoa! And that also gives you, if you've ever been in a house where you flush the toilet and the toilet starts overflowing, and you had to call the SOS guy to clean out the septic tank because the septic tank was full, lymph nodes are swollen. That's why the kidneys are so important, and the skin. Sweating and filtration of urine is real, real important. To see sediment in your urine. Can't even tell you. Yeah. No one wants to poop in a toilet, flush it, and run out and see nothing but water coming out. Oh, where did it go? I mean, it's just, you're learning the simplicity and the pillars of how everything works, spiritually and physically here. And you have to build on those pillars. The medical community is building on the pillars of what Rockefeller pushed out there, is theories, 17th century theories from who? Well, Pasteur for the germ, and who was it for the Beecham or whatever? No, but what was his name? For the disease theory. These are theories. And they are theories, and that's just how they taught them, as theories. There's no cure. There's only treatment. You poor bastard, you got this problem. You got cancer, man, you're done. But we can treat it and see if we can keep you alive a while. And maybe one can live or two could live for 10 years. I mean, it's crazy. Every time I see St. Jude's commercial, I lose it. I lose it. These guys need to be sued and tattooed. Taking your children, juicing them with chemo, see all the hair gone, and then putting them in front of the camera, saying, send us money for more research. Boy, what a hellhole. What a bunch of people that need to be sued real bad for destruction of the children. I mean, it's just, you have to understand how simple the body's made. It's made just like a house, and everything is kind of a reflection, spirituality-wise. Even the trees consume and eliminate. Everything has that consumption and elimination at one level or another. But it's real important. Know that you are making a difference in this world. Oh, I'm sorry, but I kind of got caught up, honey. When I hear a beautiful person like you go through these things, it makes me so mad, because you're beautiful people. And to have butchery out there like this, and still, and this is 2026, and we're still thinking 17th century butchery. And the pharmaceutical companies keep getting more toxic drugs on the market. Nobody's making them held accountable. No one's trying to start this toxic-free pharmacology. That would be cool as all get out, making chemicals that even take you under. Instead of using propofol, or now it's very common for them to use fentanyl. Yeah, your surgeries are full of fentanyl. When I was doing the raw alkaline diet, I was doing vegetables only. Is sugar bad for you? God, I tell you what, the misinformation out there makes you want to throw the freak up. I mean, fruit. I've always loved fruit. Fruit, we're frugivores. How can fruit be bad for frugivores? Vegetables are for your gentle giants. Vegetables are for your herbivores. Obviously, vegetables, herbivores. Why is humans eating vegetables? I don't know. Some Native Americans were very opposed to it. But, because it involved plowing and tearing up the mother skin. But I'm just saying that it's like, really, when you look to the medical world for information, you're in the wrong world, looking for the wrong stuff, because all of it's misinformation. Remember, fructose is the bad sugar. Bad sugar, fructose? And yet here's another university saying, well, the brain has to have it. Without fructose, the body will convert glucose. What? I mean, it's a bunch of wild people that don't know what the hell they're doing. I'm sorry. And I like a medical doctor as well as anybody else if you're good. But I did not feel good and was looking for recipes to help me through it. Yeah, you're not going to feel good with vegetables. You need the fruit level, especially the astringent level. This is not only a neurological, this is a lymphatic problem. I was at a thrift store and looking for a book to help, and saw a book with raw food on cover, took it home, and it was your book. Oh, wow, that's pretty cool. Yeah, probably someone dumped it in. Right away, I knew this was for me. God is good, guided me to this way of eating. Yeah, Joanna, honey, listen, I'm on your side 100%. When you see me go off, it's only on these guys that are just dum-dums. And they're hurting so many people being dum-dums. And when oncology is not just dum-dums, they're criminals. You can't juice people in the blood with 1.5 to 2 pH acid. You have no science, nothing backed on you to give you that right to do that. It doesn't even make sense. Oh, sends me to Never Never Land. Wow, we have another 5'2" individual right here. She's 175 pounds though. And the other lady was 101. 47 years young, Christina. Well, a lot of females today. Overweight, yep. Joint pain, perimenopause, lump in right breast, and fatty liver. Yeah. Well, here's the most beautiful blue eyes I've ever seen. What's that color around your pupil? Now that could be sulfur or chronic lymph. These are blue eyes, guys. So you got a lot of lymphatic problems right off to make this color of an eye, sweetheart. Let's see. Where's my light? Okay, let's take a look here. Without reading this, overweight. Of course, with 5'2", you can imagine her thyroid and her adrenals are not working well. And she's got a lump in the right breast. That means her adrenals and kidneys are down, at least on the right side. So they're not filtering. So she's getting a tumor in the right breast. And who knows where else in the body. Of course, the liver's mainly on the right side. So she's got a fatty liver. Might as well be a tumor. Same. I mean, it's, you're highly acidic. And when lipids start plaquing up, that's what gives you fatty tissue. The reason is lymphatic. Always. Your blood doesn't create lipid buildup. Perimenopause, but your pituitary is down. So you can stop menstruating at any age. Some girls that have pituitary weakness that bad don't start menstruating until they're like 17 or 18. Not quite in menopause, just short from 12 months to no cycle. Well, you can never judge that. And with your pituitary down like that, What was this lady got pregnant at 67? Your pituitary is way down. But also, my guess, your thyroid is down. Skin ring a little bit, yeah. Which is your rate of metabolism or oxidation. So that slows down. So sometimes when you're eating 3 meals a day and you have a hypothyroid, you can gain a lot of weight. And then, of course, what you eat. Potatoes, chips, stuff like very fattening stuff. Grains are not what in the order. You can't eat grains and lose weight. That's how you fatten hogs and cattle up for market, is grain feed them. Joint pain is you're just acidic all through, and the fatty liver the same way. But you got enough problems, sweetie. At 47, you got to turn this all around. You're going nowhere, man. Fast. You're going down the rabbit hole. What I call not good. I do not want to take any hormones. HRT. Why would you take hormones for? Your pituitary's down, and that is already affecting your hormones. I've gained weight. I have major anxiety. That's your adrenal glands. Your adrenal glands, and that's on top of your kidneys. And, of course, they're not filtering because your eyes are not blue. But, oh, wait a minute, they're blue. Oh, wait a minute, they're hazel. Well, now, wait a minute. I feel tight in my skin. I bet. And you're probably very edemic. A lot of this weight could be edemic weight because you're that acidic. You start having lumps in the breast and fatty livers and stuff, you're very acidic. And, of course, the inflammatory response includes what? Edema. And you can feel tight. Yeah, that's like I'm wearing a puffy suit. Absolutely. And it's not a good feeling, is it? No. And just because you're backed up all through you, you got to open up your doorway, sweetie. Maybe too much water. Yeah, but the wrong kind. Edemic water. And that's just a sign of acidosis in the body. Hair loss. Yeah, you're acidic all the way up into the brain, sweetheart. Joint pain, fatty liver issues. Now, they're all fixable. All these are fixable, but you have to do it, and you have to change your way of thinking and your diet. Listen to what we're talking about, the lymphatic system. The Homo sapien is a frugivore. So when you say I'm eating fruit, people go, wow, bizarre diet. Really, we're frugivores. Is it bizarre for a frugivore, which is a fruit-eating species, to eat fruit? I don't think so. What's bizarre is for a frugivore to eat dead animal meat. That's bizarre. I've had endometriosis. Oh, did have surgery a few years ago. Oh, honey. Yeah, that means you're really backed up lymphatically. That's what endometriosis is. That's totally your lymphatic fluids. I do have a lump in the right breast, but refuse to get biopsy. Yeah, forget the biopsy. Start knowing what that lump is. Lumps and humps, where do they come from? Your blood? No, it's not a blood clot. It's a lymph clot. All right? Just feel not healthy at all. You're not. That's why. Just not sure where to start. Well, first of all, diet important. Diet is the vital. That's the first thing you always change is your consumption of chemistry. Can't live in the same world of chemistry that's giving you all these problems and expect to get out of them. I don't know where medical doctors think diet's not related. Remember this, diet's not related to diseases. So what you eat doesn't matter to a medical doctor. Oh, really? It's true. Diseases have nothing to do with what you eat. It's all right. If you look at your sclera, you got blood vessels. Your white of your eyes are full of blood vessels. And your pupils are so small. You're extreme acidosis, sweetie. Yeah, you've got heavy sinus backing up. You got either sulfur, that's a red around your pupil in your stomach area and your GI tract area. I'm going to say some of this is chronic lymph. You have a chronic GI tract. Major malabsorption ring. You have thick lymphatic stagnation in the wall. Your pituitary is down in the right side and in the left. But you also have a weakness going straight up in the animation lifeline. Right side parathyroid is genetically weak, chronic. You want to work on that one. You get the parathyroid glandular, or take one twice a day. That's your bones. That's all of this. So you want to work on that one. Your adrenal gland is chronic, although I don't see any really nerve rings. Your right kidney is chronic. Very chronic. Your right hip is involved. Your pancreas is involved. And your right ovary is involved. Your right ovary is subacute to light chronic. Your pancreas is chronically involved. Your gallbladder and liver could be helped. You're backed up. You're backed up in your lymph system, in your liver and your gallbladder, both. And that gives you a fatty one. And you can see this. See if I can show this. See if you guys can see this. Where'd you go? Come on. Matter of fact, this is even the chest wall here, but she's backed up lymphatically in the wall. See, that's in the wall there. That's the lymph system backed up in her liver and gallbladder area. There's her chronic pancreas, her ovary, her hip, her groin, appendix. There's her chronic kidney. Look at that. Look at that. Look at that. Look at that. This one here. Oops. This one here. Yep. Look at how thick up the sinuses are thick. Very thick up in here. This is frontal lobe weakness. Don't like that spot. Can't see back here real well. Look at here, back of the head, sweetheart. I don't like that, I don't like that, I don't like that, I don't like that. These are up in your brain, honey. This is your cerebellum, mastoid area, ear, mastoid. I'm surprised you haven't mentioned that you have equilibrium or vertigo problems, but that's coming. Spleen a little bit. Now here's your left kidney right here and a left adrenal gland. This could even be considered part, although this is 6 o'clock, so it's probably your left leg. From the knee down, it looks real chronic. We could be dealing in where the uterus was removed, or here. That could be where the uteri was removed. A little bit in the bladder feed, lower back, mid-back, upper neck, throat. Yeah, parathyroid, chronic for sure. Pituitary. But yeah, your liver's all backed up. Lymphatically, but not bad cellularly. So you just have to get that lymph moving. Even your skin ring is small. But man, your pupil is so tight. Your sclera is so broken out with blood vessels. But you have a chronic bowel. Chronic bowels. So you can get ascites real easy. That's edema in the gut, and that's not good. Your sinuses here are really backed up, particularly on the left side here. Really backed up bad. Left ear. So let's see what she says. Oh no, we already read her case. Yep. Okay. Christina. Yeah, your lymph system is really backed up, sweetie. And you want that lump out of the right breast. I mean, you got to move lymph. You got to get your kidneys filtering. That one kidney, your right kidney, that's why you probably see that in the right breast. That right kidney is chronically weak. So you got to just get yourself on a fruit diet, especially with all this. Get yourself on a fruit diet. Fatty liver, all that'll come out. You can fix all that. I'd probably go on the liver gallbladder formula because I don't like what I see in your pancreas either. Generally, it's just right across the street. So I don't like what I see there either. So that liver gallbladder formula would be very helpful for you. But it's all lymphatic too. You got to remember the lymph system. Uno number one. The lymph system. Uno number one. But you don't want no lump here, and you don't want no biopsy. That's when everything goes bad. You let your body get rid of it as it's forming it. Your body forms it, and your body gets rid of it. But it's the system down that you're fighting here. Trisha, 90 pounds. Wow, 5'1". Oh my God, you guys. There's a lovely lady right there. Ooh. Brown eyes? Nah. Blue. Blue eyes. What's all that white stuff? Look at this right side of the body. Look at this, the lymph node. Look at all this thick stuff. That could be sulfur. That orange stuff could be sulfur in her. Real irritating to the bowel wall. But look how thick. See all this yellow, white? See all that? That's how thick her lymphatic system is in her gut wall. This all should be blue fibers. Of course, we don't like these spots up in the head area, do we? And this is back of the head, cerebellum and the like. We don't like that. This is going into the right lower lobe of the right lung. Don't like that. This is her right chest wall. Of Gallbladder's got a lot of lymph backed up in it. Spleen's not real happy, has a drug deposit in it. Looks like. Adrenals, kidneys. What's that? Oh my God. Well, that's upper C-spine or throat. You're right there. That's generally throat weakness. And this to me would be your upper C-spine. That's up in the head. I don't like that at all. But go over here and see problems up in that area. See that? And then you're up here in the upper C-spine. You could consider this a large scurf ring, skin ring. But then what do we got right here? Parathyroid, thyroid. Look up in here. Definitely chronic pituitary, chronic pineal gland. Look at all this going up into her head there. We don't want that. So we see how it goes right down to the bowel wall. That's because this is where the genetics start, right there. I don't believe this is heart area. I believe this is the lower bronchial trunk to the lower left lung, but, this is starting to get near the heart area. And, Jensen could call that the heart lesion. Kidneys. All right. Hello, Dr. Morse. I would appreciate your perspective on a change in tumor physical characteristics. Well, I've seen them do all kinds of things. I've seen them change on all kinds of directions in breasts and everywhere else. Of course, I've always been conflicted between pulling and pulling. External and internal. I was diagnosed with stage 2A hormone receptor positive invasive ductal carcinoma. That's a mouthful. Last spring, that has remained about 2 centimeters several months while on an aromatase inhibitor. For the past, I just have this thing. What you suppress today is your nightmare from hell tomorrow. And we've talked about that. I saw it on Body Bazaar recently on Living in My Body or something like that. Oh my God. They had 2 cases. One was from too much antibiotic use, which made this black guy white and destroyed his bones. It's just like it shut down all his endocrine glands. And this other lady was a skin lady. There was a lot of you have skin problems. She started with eczema, took steroids, and had major steroid reactions. And she's a mess. All fixable, but they don't come to us to be fixed. For the past 6 months, I have also followed a natural protocol, including a fruit and vegetable-based diet, herbal detox, immune support, prescription topical curcumin, IV vitamin C. Holy crap, honey, you're doing it all. Mistletoe injections, hyperbaric chambers, sauna use, lymphatic massage, and regular exercise. Woo-wee, a hell of a woman. I don't blame you, though, because you have a hell of a body to deal with here. Yeah. Heavy lymphatic problems, heavy. And especially on that left side. It could be because the picture you gave is real close and up. It could just be that, but you got a lot of lymphatic problems. And I do think you have sulfur, which means you have fungal problems. But again, that could be chronic lymph. I don't think so. It could have chronic lymph, but you just have real thick, backed up lymph. Were you a milk drinker, cheese eater, dairy consumer? Because you've got pretty thick lymphatic problems. And then if you look at your sclera, you got blood vessels, like we were talking to the other lady, all over the place. It doesn't matter what, like this is. Okay, stage 2A, hormonal receptor, positive, invasive. All that is just blah, 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 gookity gook. You've got lymphatic problems. Doesn't matter what receptor it's affecting. It doesn't matter anything like that. You have serious lymphatic problems. It doesn't matter all that. It's just good intellectualism for those guys. When the problem is all the same, right? Okay, so I'm going to look at all the things that you've done for this. Give you my opinion. First of all, when you're woken up. When you wake up to the fact that you've got a tumor, vessel matter is like blowing in the wind. Yep. That's a big no-no. You're wasting your time. From Gerson to the Hippocrates, wasting your time in terms of trying to get rid of a tumor. Fruit is the only level that's going to help you get rid of tumors properly. And then, of course, use the herbs. There's a lot of great herbs for tumors, but understand that the problem's in your kidneys. And open that doorway up. All right? IV vitamin C. That's IV ascorbic, what is it? Ascorbic, what is it? Oh, acid. Yeah, I've seen reports where people got hardening of the arteries from doing that. What's vitamin C going to do? Ascorbic acid is a spin-off on the Krebs cycle. What is good is that at helping the lymphatic system? You could argue flavonoid complexes in fruit, rutin and all the flavonoid complexes, but that's in an alkaline slurry. Vitamin C is a spin-off. It's an acid. That's why you get buffered vitamin C. Oh, I mean, the hype on vitamin C makes you want to throw up. I mean, terrible. I've heard of the mistletoe. But again, think about what you're doing. Think about the system that's in trouble and how do I work on the lymphatic system. Lymphatic massages would be perfect as long as they understand the neural lymphatic points, the kinesiology points. Basic lymphatic massage by a massage therapist, they don't know why they're doing massage therapy. I mean, your lymphatic system is the reason for massage therapy, but they're doing it allopathically thinking. Hyperbaric chamber, no way, Jose. I mean, it can make your eyes pop out and bulge out and look like egg shape. It can do all kinds of things to you. Seen it. No, you're not trying to shove oxygen into the cells. No. And I've talked to the guy who invented the hyperbaric chamber. We had a long conversation on the phone. Sauna, yeah, absolutely. Get yourself to sweat. Regular exercise, yeah, well, be careful. Passive would be good. Swimming and stuff. Over time, the feel and appearance change. I am trying to understand what tissue processes could cause this pattern of change. Not getting it. All that you're doing doesn't make the kidneys filter lymph. All that you're doing doesn't make the lymphatic system filter better. Massage moves it around. You're trying to open the doorways of getting your lymphatic system to filter out of your body. Your body's holding your sewage like nobody's business. You're backed up big time. And all these treatments are just, if you want an herbal detox, it's got to be toward the kidneys and the lymphatic system and getting your kidneys to filter. Other than that, you're going to see things get worse and worse and worse and worse. Even though you're doing everything natural, that doesn't mean you're on point. Okay. Become raised from the surface, then flattened, now firm and white, scar-like appearance, no redness, heat, discharge, or pain. That's good. That's good right there. That's good. But as your lymph system is moving, your tumors could change shape, absolutely. Even if you're just moving lymph variably around localized tissue, you want to get your whole sewer system in line. You want to get your lymph nodes opened up, and the only way to do that is pull that cork out of that wine bottle, pull that cork out, and that cork is your kidneys. Your kidneys are your blockages. And skin, the sauna is a good thing, because your pituitary is chronic. Your pituitary is way down. And that's going to make your thyroid down, your parathyroid down, and you already have a little bit of a chronic parathyroid already. And that's very important to think about. Calcium plays a major role in nerve transmission, obviously skeletal, connective tissue, happiness. My imaging shows the mass has shrunk by about 50%. Perfect. It now measures 1 by 2 centimeter on QT and 1.6 by 1.4 on ultrasound. I tell you what, I trust a CAT scan in a diagnostic point of view far more than an ultrasound. The QT scan showed normal architecture overall, and aside from the mass, the breast was unremarkable. Cool. I mean, that you just keep moving that lymph, and that tumor will eventually be gone. Don't mess with it. You know, if you mess with anything, mess with the kidneys. Get the kidneys to filter. My doctor believes what remains may be fibrotic tissue, scar tissue. It could, but you want that gone too, right? All right. And I would love to hear your perspective on that. I mean, it could be, I don't know. What side of chemistry scars tissue? Oh, acids. So, but if it is, you want that out. Even if it is scar tissue. I'm not saying it is or isn't, but you're pretty backed up lymphatically. And you know, both breasts are backed up lymphatically. So you just have to open that system up and these things will come out. They're not stuck there forever. No, they have a pathway, and that pathway is your lymphatic system, which includes the lymph nodes, and that's your stagnant system. That's why an all-fruit diet is vital. Highest in your electrical energies, highest in your astringent energies, way over vegetables, highest in your electrons, your hydrating ability of the body. Vegetables require a lot of chewing, a lot of breaking down. So even though at raw there may be 9,000 units of energy, where a fruit is 13, say, you're going to subtract, let's say, 1,000 or 1,500 for digestion of fruit and maybe 3,000 for the digestion of vegetables. Because you're looking at the net energy release, right, from after digestion. And so if you're talking about a labored digestive process, that's any process is an energetic process. You want food that give you energy and not take it away. That's why all raw. Cooked food just sucks energy out of you. But raw food gives you energy. But in the processing to give you that energy, fruits are far more lending of itself of much higher levels of energy. That's why it's a neural sugar. That's why fructose is a neurological sugar. That's why Yale discovered that, and it's why we've been so successful in our clinicals at neurological problems, because we use only fruit. I've seen one, and I've given you the cases. I've seen what it looks like on a fruit diet in a quad or para, and then on a vegetable diet. I've seen it firsthand, even on an MS case. We've seen it, what it can do and can't do. And your fruit are always on top. But we're a frugivore species, not a herbivore species. We don't have the same teeth and grinding factor and extra compartments and a lot longer gut than a herbivore. We're just not made like those. We're not made like horses, cows, elephants, rhinos. We're not made like those animals. We don't even look like them. So I find it quite interesting that humans have got caught up on this and the Hippocrates vegetables. Really? Stupid. I also completed a Signatera, I don't know what that is, test last week. My doctor ordered serial testing every 2 months for 2 years, then every 3 months for the following 2 years. Yeah, you can sit and do all these tests. Be careful, any radiation involved and stuff. And you can sit and watch it. I wouldn't. Why put yourself through that stress? You want to do something about it. You got to fix your lymphatic system, because it ain't just that coming. You've got back of the head problems. You've got digestive problems. You've got, other problems here that you need to fix. And eventually every 6 months, long-term, as long as boy makes in some good money for him, though. I need to get of course, I'm not seeing anybody anymore, but man, I need to get you guys to come back in every couple months. I understand the reoccurrence window for hormone receptor positive breast. Oh, here we go. Breast cancer can extend decades, so this monitoring feels important. And that's a lot of hoopty-la. Yeah, really? Ba, 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 ba. This is a lymphatic problem, honey, and that's what you got to fix. You can go in this hormone receptor positive breast cancer extends for decades. Really? It's a good fear factor. And it could if you never fixed anything, but I don't think you'll live that long. Your lymphatic system is in serious trouble, and you need to fix it. All right? Tricia. Oh, here's more. Surgery doesn't feel right for me. What are you going to do? You keep cutting out. You can keep removing. You know, some people come in and used to come in and see me, and how many organs do you have left? Keep removing. How about fixing things? Well, you can't fix things you don't understand it, and that's why these videos, to get you to understand the simplicity of the lymphatic system and the body and how it works, and the simplicity of the two sides of chemistry. That's very serious. Life in this physical universe and in the physical realm is a chemical experience. A chemistry can give you a big kiss on the cheek or rip you apart. Especially given my concerns about the surgery trigger hypothesis. I weigh 90 pounds before my diagnosis last spring, but you're what, 5'1". I was 104 pounds. Yeah. Well, you're going to go down a little bit, sweetheart, because you're malabsorbed and you've got to focus on your sewer system. Come hell or high water, this is the system you're dealing with. Until you get your lymphatic system filtering and moving through, you raise the probability of popping tumors all over the place. Oh, then they'll just tell you it moved on you. I stopped the aromatase inhibitor late March due to side effects. Hello? I have a prescription for tamoxifen. You know, tamoxifen, the World Health Organization lists tamoxifen as a carcinogen. They give it for ladies as an estrogen inhibitor, but it's a carcinogen according to the World Health Organization. In other words, it causes the thing they give it to you for. You're not trying to inhibit anything. Forget the positive receptors and all this bullshit. You're not trying to inhibit anything. You're trying to bring in balance, and you're trying to get your sewer system opened up. Your sewer system's backed up, and as long as it's backed up, you can treat it and do anything you want at it. Still going to get backed up, and you're going to keep getting backed up until you open those magic doorways through the kidneys, and you're doing right with the sun and sweating. You either sweat it out or pee it out. Other than that, you ooze it out. Under the breast, in the armpits, in the groin, between the toes. Ew. Ew. I'm reluctant to take it due to all the side effects. Yeah. And you don't want to suppress what you suppress today. You're not trying to suppress estrogen. And considering, and a lot of the countries consider it a carcinogen in and of itself. In other words, it causes cancer. Oh, I also believe that the IDC, which developed, was due to toxic overload stress, sedentary lifestyle, and poor diet. Honey, your sewer system's backed up, period, end of story. And you can blame it all on the above. Since my diagnosis, I have corrected these issues. Sounds like a good woman to me. See a little seriousness in those eyes of yours? I would be very serious. From your viewpoint, what psychological processes might explain these changes in tissue character? Well, you got weak adrenals. They're down. So, emotions, anything like that doesn't matter. Psychological processes doesn't matter. If you care too much, you get hurt. You get a feedback. Negative emotions. Just hook up to that. It's only $250. Marco's got it up. It's and Nicholas and Debbie's got it up. It's the spirituality side of naturopathy, and listen to it. You have physiological reasons why there's anxieties and depressions and things like that, and of course those can trip, but just your own lost in space in the spiritual worlds. In other words, your emotional body out of balance, your mental body out of balance, and then you can get out of balance in your desires for food, and it just creates an out of balance scenario. That's why meditation, relaxation, pulling back from the emotions, I don't care anymore, I'm detached, Buddha, that sort of thing. And hug yourself. Spend some time alone with yourself and say, you know what? This is just a body, and I am very backed up in my sewer system, and I need to get those doors open. That will then begin to fix everything. But you can't rebuild tissue in an acidic medium. You're just that's why surgeries have a hard time fixing themselves, repairing sometimes. And if your parathyroid has been removed and you're going under surgeries, you can never heal properly. Thank you for your educational work. I wish I could meet with you in person. Well, come by sometime, sweetie. Where are you from? Doesn't say. Does not say. But your eyes tell a big story. You now and where you need to go. Okay? All this thick white. This could be sulfur, the orange. All this thick white. Thick, look how thick. That's acid. Acid mucus, acid full of it. So you want to open some doors. Your kidneys are not that bad. You open those kidneys up and get them filtering. But me, a case like this, your level of fear, I'm going to live on grapes for the next 6 months or a bunch of fruit that's very similar. Stay away from acid fruit, pineapple, stuff like that, and get yourself hydrated properly. You've got to open your elimination doors. That's what we teach, and I'll teach that till the day I croak off of this planet, because there's nothing else to be said about it. If you live in the fiction world of the medical world of the illusion called disease, as I call it, or the fallacy of a theory of the 17th century, look at the level of a consciousness in the 17th century. If you could have an out-of-body experience and go back to the 17th century and look at the level of awareness of humans had, and then look at you now, you'd be shocked. Even back in the Vietnam days, you'd be shocked at the level or lack thereof awareness of humans and what they did to the guys and girls going to Vietnam. Send them there and then yell at them for going. I mean, they thought long-haired people were communists. Now you have communists. The Democratic Party has turned communist, hasn't it? Fetterman, you better run for president. The guy that had the stroke is the only one that has any brains. Holy crap, man! You can't push socialism and communism in this country. No, you don't have no idea what that's like. That'll destroy this country, and then down goes the world. I mean, it's not the positive and negative forces are at battle, and you want to be at least on the positive side. And freedom is the sign of the bell that rings. Freedom is your freedom from thought, freedom from emotions. That's consciousness. You want to free yourself from this world, from politics, from all of that. It's difficult because there's so much hate out there right now, so much this and this. It's like, really? How do we make things better? How do we have more toxic-free pharmaceuticals? How do we learn that what's causing these cells to break down in humans? What causes tumors? You know, it's time for the medical community to break out of the prison that they put themselves in. And they're pulling more and more people into their prison with them. I'm not saying medical doctors are not needed, not saying that. Oncology, you guys are serious problems. You got to wake up to the lymphatic system and what it really is and how you open those doors and how you simply cure people with tumors. No big deal. The cells that are damaged replaces themselves. Piece of cake. But when you can't move the lymph around tissue, the whole tissue's going to go. Bone, whatever, don't matter where. Don't be fooled. Wake up to the truth. If you can afford our classes, take our just the level 1. Really learn about the lymph system, the chemistry and physics involved. Simple. I think I make things as simple as I can because I'm a pretty simple guy. That's why I can't pronounce these words that long. Who cares? I don't want to waste my time. Why should I put so much energy into the mind for? It'll just trap me and lock me away in a prison. You have to be careful with your thoughts or others. You know, same thing with emotions. Most of you are trapped here in your thoughts and your emotions. Let go of them. Who cares? That's why meditation was developed, the ability to step back, the ability to be in the now. And that's being brought out more and more and more. The ability to be in the present moment beyond thought and desire. And that's where all life comes from. Love you guys. And hope that helps. You got some serious cases here, serious lymphatic cases. And the sewer system and acids are very serious. And yet, they skip over it like it's nothing. Everything is blood, blood, blood. Or it's your estrogen receptors. It's all this stuff. Understand how simple the body's made. Bunch of cells and 2 fluids, and there's only 2 sides to chemistry. And each fluid takes care of each side of chemistry. You can't get much simpler than that. And when you understand that, and you understand the design of the Homo sapien as a frugivore, we're fruits. And when they say fructose is bad for you, who's the numbnuts there? These people. A lot of meat on their dead animals while they lose their kidneys and bowels, and you eat on your fruit while you gain your awareness. All right. You don't tell a kitty cat to go eat a bunch of fruit because they're a carnivore. And you don't tell a primate to go out and eat a bunch of meat because they're frugivores. And we're primates, we're frugivores. Like it or not? Matter of fact, I want a bunch of fruit. I'm ready for lunch. Love you guys. I'll catch you Wednesday. Nothing else is going on. So far, it's not too busy of a week. All right. Love you guys.